The next joint that we're going to examine is the elbow joint. The elbow joint is a joint just like any other that we start with inspection. Oftentimes when inspecting the elbow joint, important things to look for are areas of deformity or swelling that can lead you to your diagnosis. After inspection, palpation can be very beneficial, especially with medial and lateral epicondylitis. Palpating that area can really tell you where your pain source is coming from. So really kind of let pain be your guide when palpating the elbow joint. Following that, we then like to move into range of motion. Oftentimes I have the patient start with active flexion of the elbow and then going in and making sure that they can get to full extension. You may even want to pay attention to see if they have hypermobility or go past 0 degrees. The other thing you want to then look at is their pronation and supination, making sure there's no deficits with that. If you notice any deficits, you can then put them through further range of motion testing. Following that, strength testing, you're going to obviously bring them up into full flexion and test their strength, both in flexion. I like to then do their extension and full extension and making sure that you cannot break that tricep muscle. If you wanted to do resisted pronation to see if that gives you a clue, or resisted supination, both of those can be beneficial as well. Following the strength testing, we then move into our specialized tests. A lot of these are going to be focused on areas that would be sources of pain. So the medial elbow, common sources of pain, especially with overhead athletes, would be the ulnar collateral ligament along the medial aspect here. So simply starting with a valgus stress test to stress that ligament, seeing if you can recreate pain and symptoms or if you feel any instability. This can also be transitioned into a milk test where your distal hand will grip the thumb, and then starting at 0 degrees you apply that same force through the elbow joint, and then you can move up into flexion, testing that throughout their full range of motion to see if you notice any pain or instability. This test can also be done independently by the patient. Another area that can be beneficial is if you're thinking you have medial epicondylitis, is doing good resisted motion, making sure that you don't feel their ulnar nerve popping across there or subluxing, as this can sometimes fool you in that area. Another test that can be done on the nerve is tapping, doing a Tinel's test in the cubital tunnel. When you tap along that nerve, if it's sending shooting pains or numbness tingling down the arm, that can often be a positive test. Then moving over to the lateral elbow, the main test that we do here is for lateral epicondylitis. One good test here can be the resisted middle finger extension test. What we do here is you have the patient go into full extension with the finger pushing up against your finger, seeing if that recreates their pain at the elbow. Wrist extension can also be another good way to test that. And really that's the main specialized test that we'll cover in this video, but if you have further questions or tests that you'd want to look at, BGSM is another good online resource.